Okay, so hydatid cyst is also known as echinosis. So it's a zoonosis, and the definitive host is a dog. D for dog, just remember, definitive host dog. Okay, and humans are intermediate host and accidental intermediate host. So humans are accidental intermediate host, and no human to human transmission is seen. Okay, so there are many types of echinosis, but the echinosis subspecies, but echinosis granulosus is most common type. This can be as echinosis granulosus is most common type. Okay, so other ones are echinosis multilocularis and echinosis ligatus. Okay. Okay. So in dogs, the adult tapeworm attached to the ileum of the definitive host. Okay. Okay, and sheeps are also intermediate host. So it is most commonly seen in sheep's rearing area. Okay. Okay. Humans are accidental intermediate host, already told you, and this is the end stage of parasite. If parasite infect the humans, the cycle ends in human only. Okay, in human they generally present in duodenum. Okay, so in dog it is ileum, in human it is duodenum, and the stage of larva is oncosphere. Okay, oncosphere. Okay, and that penetrates the mucosa. Okay, so oncosphere reach the liver most commonly via hematogenous route. Okay, so via hematogenous route it is reached to the liver. Okay, 3 weeks after infection a visible hydatid cyst develop, not that important. Okay, so that cyst is composed of 3 layers. The first one is pericyst. It is derived from the host tissue. Okay, many times the pericyst is derived from the host. Okay, and the cyst wall itself has a 2 layer. The outer is ectocyst and inner is endocyst. Okay. Okay, and the inner one is also known as germinal membrane. Okay, endocyst is germinal membrane. Okay. Okay. So in definitive host, scoliosis develop into an adult tapeworm, but in intermediate host they differentiate into new hydatid cyst. So in humans and sheep they develop only cyst, but in definitive host like in dog they can develop in adult tapeworm. Important difference. Okay, so freed brood capsule and scoliosis form the hydatid sand. So scoliosis, as far as scoliosis form the sand along with brood capsule. Okay. Okay. Daughter cysts are also true replicates of the mother cyst. Okay. Okay. Calcification of hydatid cyst, however, does not always imply the cyst is dead. This is can be one liner. Okay, so calcification does not imply the cyst is always dead, always. Okay, so hydatid cysts are diagnosed in equally in man and woman. Okay, though no sex predilection. Okay, and mostly in the right side of the liver, and generally are solitary, single. Okay, and clinically when the patient present to you, it is generally large and asymptomatic. Okay, large and asymptomatic. Most common presenting symptom are abdominal pain along with dyspepsia and vomiting, and most common sign is hepatomegaly along with jaundice and fever. So symptoms are abdominal pain, dyspepsia and vomiting, and signs are hepatomegaly, jaundice and fever. Rupture of the cyst can occur into peritoneal, pleural and pericardial cavity. Okay, but the most commonly in biliary tree. Okay, so most common rupture in biliary tree. Okay. Okay. And if it is rupture in peritoneal cavity and all, it can cause fatal anaphylactic reaction. Okay, so Ultrasound is most commonly used worldwide for diagnosis. Okay. So in simple hydatid cyst, budding sign is present. So it contains free floating hyperechogenic hydatid sand. Okay. And roset appearance is seen when daughter cysts are present. So roset appearance means daughter cysts are present. And calcification of the wall of the cyst highly suggestive of hydatid disease. Okay. 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 Treatment of hepatic hydatid disease is primarily surgical. Okay. So older patient with a small asymptomatic densely calcified cyst, conservative management can be considered. So old patient, small asymptomatic densely calcified, you can go for conservative management. Okay. So pre-operative steroid was recommended but not universally used, and when its patient is intra-op, anesthetists are advised to keep ready epinephrine and steroid available. Okay. When you open the abdomen, you should pack the abdomen so that you can avoid the spillage. Okay. Okay. Cyst is usually aspirated through the closed suction and flushed with scolocidal agents such as hypertonic saline, and then cyst is unroofed. If you do excision, it is also known as pericystectomy, or you can also do marsupialization, leaving the cyst open, drainage of the cyst, and omentoplasty and partial hepatectomy. Okay. Okay. So both radical resection or conservative, that is drainage and evacuation surgical approach, appear to be equally effective. So radical means resection, you have to do resection, and conservative means drainage and evacuation. When bile duct communication is diagnosed, it is surgery should be done meticulously, and simple suture repair can be done. Okay. And pre-op ERCP may be necessary. Okay. Okay. So they ask generally in PG or FMGE, generally ask what is the full form of PAIR. So it's a puncture, aspiration, injection, and re-aspiration. Okay. P for puncture. Okay. Many books write percutaneous also, but if you have to choose one, go for puncture. Surgery remains the treatment of choice, already told. So treatment of echinosis is with albendazole or mebendazole. Okay. So shrinking cyst in many patients with echinococcus granulosis infection. Okay. So pre-operative treatment may decrease the risk of spillage. Okay. Okay. Medical therapy without definitive resection or drainage should be considered only for widely disseminated disease or poor surgical candidate. Okay. Okay. So this much was from Sabiston. Let's see what Bailey given. So we will not repeat the same points. Okay. So this is also known as dog tapeworm. Okay. So intermediate host are humans, sheep, and cattle also. Okay. So here cyst given nicely. So cysts consist of 3 layers: outer pericyst derived from host organ. Intermediate is hyaline ectocyst. Okay. It is non-infective, and the innermost is endocyst. It is germinal membrane, and this contain viable parasite. Okay. And this form the daughter cyst. Okay. So Echinococcus multiloculis, in which the cyst is spread from the outside by actual invasion rather than expansion. So cyst is spread outset by actual invasion. So invasion is present in multilocularis. Okay. Okay. So WHO has given ultrasound based classification. Okay. Based on the status of activity of the cyst. Okay. Sorry. So this is outdated, still given in New Bailey. Okay. So based on activity of cyst, there are 3 groups. Group 1 is active group, cyst larger than 2 cm and fertile. Group 2 is transition. 1 is active, A is active, 1 is active, 2 is transition, and 3 is inactive, okay, degenerated, unlikely to. So 3 is calcified, 3 is calcified, C, okay, unlikely to contain viable proctoscoliosis, okay. So it can colonize every organ in the body, okay. The patient in question may it give you it, the patient is sheep farmer, okay, that's why I have highlighted this, okay. Liver is most common organ affected, and next one is lungs, okay. So patient is having pain, dull pain because of stretching of liver capsule, and if the patient is have dyspnea, it may be because of pulmonary lesion, okay. And cyst may communicate with biliary tree. In that case, patient will present as obstructive jaundice, okay. And unexplained headache may give rise suspicion of cerebral hydatid cyst, okay. Okay. So this is CT scan of hydatid cyst of pancreas, okay, not liver, pancreas. So let's see classification of hepatic hydatid cyst. Previously it was given as a Gerby classification, but now it has been changed. We will see Gerby classification also later. So CL means cystic lesion, unilocular anechoic cystic lesion, cystic echinosis 1, okay. So it contains the fine internal echo that represent proctoscoliosis, that is called hydatid sand. So you have to remember, 1 is hydatid sand, okay, okay. Then 2 contains the honeycomb, 2 names, honeycomb, cartwheel and rosette formation. So this is 2, okay, that is cyst with internal septation representing the wall of daughter cyst, okay. Multivesicular, okay. Now 3 is also divided into 3A and 3B. 3 is transitional stage, okay. So 3A is daughter cyst with detached laminated membrane, and 3B is daughter cyst inside the solid matrix. So inside the solid matrix is 3B, and 3A is also known as water lily sign. We will see in other books, okay. And then 4 and 5 are inactive or degenerated cyst, okay. So daughter cyst can no longer be seen in 4. So bag of wool is 4 letters, so 4, and 5 is calcification, okay, okay. Now come to diagnosis. So in diagnosis you may get raised eosinophil count, ELISA test or electrophoresis. So ultrasound and CT scan are investigation of choice as per Bailey. So treatment should be done in tertiary unit, and the pair full form already explained, or antihelminthic drug like you can use albendazole or praziquantel also, okay. So in summary form they have written CT scan is best imaging technique. So if you have to choose one, you go for CT scan. So these are the picture based question you may get. Hydatid cyst of abdomen disseminated, and this is MRI, okay, okay. And this is double edged wall. So hydatid cyst that separated after travel injury, okay. So this question has been asked, okay. So now comes, what are the scolocidal agent? So hypertonic saline 15 to 20%, the 20% is specific, ethanol 95%, and providine iodine they have given, okay, 5% providine iodine, okay. But as the Blumgart say, you should never use providine iodine, okay. Active cyst should be first treated with full course of albendazole. In laparoscopic management, you should do laparoscopic marsupialization of the cyst, that is called deroofing, and removal of the cyst, the most common procedure. Okay. And if the cyst is small and superficial, a cystopericystectomy should be performed. Okay. A few points regarding pulmonary hydatid disease. The lung, as already said, lung is second most common affected. Okay. Mostly the right lung, since liver is in right side and lower lobe. Okay. In chest radiograph, you may get meniscus or crescent sign. It is a sign of impending rupture. When cyst rupture, then water lily sign on CT scan. So in X-ray, you will see the meniscus and crescent sign. Okay, so cyst has not yet rupture, impending rupture. And in cyst, if cyst rupture, water lily, so it's rupture, that's why it's floating. So water lily sign on CT scan. Okay. Okay. So mainstay of treatment of pulmonary hydatid disease is surgery. So in both liver and lungs, the mainstay treatment is surgery. Okay. So medical treatment is less successful, and surgery, if surgery is not possible because of poor general condition of the patient, diffuse disease affected both lungs, and recurrent or ruptured cyst. So in case of ruptured cyst, also you should go for medical management. Okay, because of anaphylaxis and all. Okay. So, and what are the surgical option? Cystotomy, capnotase, pericystectomy, segmentectomy, and pneumonectomy. Okay. 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 These are the picture of meniscal sign, water lily sign on CT scan. Okay. Water lily sign also showed on X-ray, but it is mainly seen on CT. Okay. Okay. Any important point from Schwartz? Okay. Cyst can also present in lungs, spleen, brain, and bone. Okay. Already told, hydatid cyst is most common in ship raising area. Medical treatment with albendazole relies on drug diffusion through cyst membrane. So albendazole diffuse through the cyst membrane.